Gwinnett's Opioid Abatement Advisory Committee is working to learn how best to spend more than $1 million meant to combat the opioid crisis, a crisis that continues to claim precious lives here in Gwinnett County.
In my car. Stand by.
In this body cam video from Gwinnett Police Corporal William Breitfelder in September, he and Corporal Michael Ricks used Narcan to revive a suspect who had fallen out of the back of his patrol car. The officers had detained the man after observing him in an alleged drug deal. Doctors later confirmed the suspect had fentanyl in his system.
There we go.
You may not see many headlines in the news anymore about the opioid crisis, but the crisis is far from over.
There you go. Keep breathing.
Frederica Robertson knows this all too well.
My son passed away in April, and I started a foundation in his remembrance, the Marquavius Bernard Broughton Foundation.
That's why she came to town halls put on by Gwinnett County's Opioid Abatement Advisory Committee. While data from the Gwinnett County Medical Examiner shows a decline in confirmed opioid overdose deaths in recent years, many who came to the town halls say they're seeing a rise in demand for support, including opioid addiction treatment and overdose prevention.
We serve in 5 emergency rooms when somebody overdoses or they're high risk for overdose. We serve in each hospital in Gwinnett County, and we have had a rise in the calls that are coming out to us.
Even the committee's members are not immune to the devastating effects of this ongoing crisis.
The 2.5 weeks ago, a 27-year-old that I've known since she was a very young girl, she passed away from an overdose. Had been clean for 11 months and relapsed and has a 1-month-old baby.
Major Chiquita Maldonado heads the Gwinnett Sheriff's Office Mental Health Task Force. She says these examples show why they need to hear from people on the front lines of this crisis about how best to spend these settlement funds.
Give us their recommendation and what they see us missing.
District 3 Commissioner Jasper Watkins says it's part of the county doing its due diligence.
You have to understand where the awareness is. Where do you need the help?
So where do these funds come from? A national settlement from a 2021 lawsuit against major pharmaceutical companies got Georgia around $638 million. About $191 million of that is distributed by a state trust to governments like Gwinnett for opioid abuse reduction. From that, the state trustee gave the county this $1.2 million, but more could be coming in future rounds of distribution. Town hall moderators got a lot of feedback on how this money could be spent, like adding more long-term treatment centers and prevention programs. Robertson says expanded access to treatment is what her son needed.
I feel like my son, the day before he passed away, he called 18 places. We had insurance, but they didn't accept our insurance, or it was out of network. We need to be able to have these resources available, ready and available. And I believe these funds will be able to allow for those things to happen.
Major Maldonado says the committee is going to use all this feedback when making their recommendation to the Board of Commissioners on how to use these funds to save the most lives. For Gwinnett County, I'm Eric Mock.